Today we are going to learn about tetracyclines. These are a group of drugs that come under antibiotics. They are bacteriostatic in nature, which means that they will only suspend the growth of the bacteria. Now, if you watched our previous video, you would know that in this video series we have tried to classify antibiotics under 6 different headings, which are the mechanism of action, susceptible organisms, resistant organisms or the mechanism by which they acquire resistance, pharmacokinetics of the drug, examples, adverse effects, and uses of the drug. We will either combine the uses and the examples, but here we have tried to place them separately. So let us start with the mechanism of action of tetracyclines. These drugs inhibit bacterial protein synthesis by binding to the 30S ribosome. So here I've made a small little diagram so that we can understand the mechanism of action properly. This amino acyl tRNA binds to the A site, and this is when the translation process occurs and it continues. So the tetracyclines bind to the 30S ribosome and they inhibit the attachment of amino acyl tRNA to the A site. This is how the bacterial protein synthesis is inhibited. Once you study antibiotics, you will know that there are many drugs which inhibit bacterial protein synthesis. Tetracyclines are one of them. But there are only 2 drugs which will bind to the 30S ribosome of the 30S subunit of the ribosome. That is tetracyclines and aminoglycosides. So this is the mechanism of action. Moving on, tetracyclines need a carrier for entering the cell, but in gram-negative bacteria, tetracyclines can also diffuse through porin channels. Before we move on to resistance, let us look at a few susceptible organisms. Now, tetracyclines are wide spectrum or broad spectrum antibiotics, which means that they have an effect on a large number of organisms. Specifically, if they have a good effect of gram-negative bacilli, then they are considered to be broad spectrum because these are the bacteria that cause the maximum number of illnesses. Now I've classified gram-negative, gram-positive and gram-negative bacteria as cocci and bacilli. So let us look at them. The gram-positive cocci which are susceptible are Streptococcus, Staphylococcus and MRSA or methicillin-resistant Staphylococcus aureus. Next we have a few bacilli, gram-positive bacilli, that is Clostridia, Listeria, Corynebacterium diphtheriae, Bacillus anthracis. Now let us come to the gram-negative organisms. For gram-negative cocci, you can remember Neisseria. For gram-negative bacilli, you can remember Klebsiella, Brucella, Vibrio cholerae, and many more. Tetracyclines also act against spirochetes like Treponema pallidum. They are also effective against Rickettsia, Chlamydia, and Mycoplasma. Also, at very high concentrations, tetracyclines can act against Antiamoeba histolytica. Let us move on to resistance now. Bacteria can use efflux pump against tetracyclines. This means that suppose if we have a bacterial cell wall and there is an efflux pump over there, then that bacteria can use that pump to flush out the tetracycline, and this can reduce the effectivity of tetracyclines. The second mechanism can be by the formation of protection proteins. This protection protein can protect the ribosomal binding site from tetracyclines because that is how the tetracyclines were acting, by binding to the 30S subunit of the ribosome. Now, partial cross resistance has been seen between tetracyclines and chloramphenicol. This means that if a drug is resistant to tetracycline, it will also be resistant to chloramphenicol. Let us look at the pharmacokinetics of tetracyclines now. Pharmacokinetics is studied under the 4 headings: absorption, distribution, metabolism, and excretion. So starting with absorption, Older tetracyclines, that is, those tetracyclines which were formed earlier, are incompletely absorbed from GIT. They are better absorbed in the absence of food. But there is an exception to the statement. Doxycycline and minocycline are completely absorbed even in the presence of food, as they don't react with food. A very, very important property of tetracyclines is chelating property. This means that they form insoluble and unabsorbable complexes in the presence of calcium, milk, and iron, that is with them. This is a very important property, and we will recall it again when we go to the adverse effects. Distribution. Tetracyclines are widely distributed in the body, but they are specifically more concentrated in the liver, spleen, bone, and teeth. They are more concentrated in the bone and teeth because of their chelating property, as bone and teeth contain calcium. So, calcium forms the inabsorbable and insoluble complexes with tetracyclines. Remember liver and spleen as well. CSF concentration is not very significant, it is only 1/4 of the plasma concentration. Coming to excretion, these drugs are mostly excreted by the kidney. Doxycycline, though, undergoes enterohepatic circulation, that is, metabolism can also be through the liver. Doxycycline undergoes enterohepatic circulation, so significant amount of the drug is excreted through the bile, and it is also secreted in the milk. Now, before we look at the adverse effects of tetracyclines, it is better to know their names and their classification. So, the natural tetracyclines are tetracycline, oxytetracycline, and dimethylcycline. You can remember this by the acronym DOT. Semi-synthetic tetracyclines are doxycycline and minocycline. Glycyl, there is also a newer tetracycline, which is a glycyl cycline. It is known as tigecycline. Coming to the adverse effects of tetracyclines, you can remember them very easily by the acronym Kapil-Dev. We've taken them from the GRG textbook. K stands for kidney failure. We just saw that tetracyclines were mostly excreted through the kidney, so it is not a very fascinating thing that they cause kidney failure. But there is an exception, which is doxycycline. It does not cause kidney failure. So now, if you ever face an MCQ that says which of the following tetracyclines does not cause kidney failure, you can mark doxycycline without a second thought. A here stands for anti-anabolic effect. Tetracyclines will decrease protein synthesis and increase the blood urea level. P stands for phototoxicity. They can cause sunburns or severe skin reactions, except dimethylcycline. I here stands for diabetes insipidus. Dimethylcycline is a drug that can lead to diabetes insipidus. This is because it antagonizes ADH action. ADH is the antidiuretic hormone which is responsible for the reabsorption of water in the DCT and the collecting tubules. So if dimethylcycline will inhibit the action of ADH, naturally it will lead to a condition like diabetes insipidus. L stands for liver failure. We also saw that doxycycline underwent enterohepatic circulation, and that tetracyclines were more concentrated in the liver, so they can also cause liver failure, which will lead to fatty infiltration of liver and also cause jaundice. There is a condition called fatal acute hepatic necrosis that can occur in pregnant female. So this is why they are also contraindicated in pregnancy. D stands for dentition and bone. Tetracyclines have a chelating property, so they deposit in developing bone and teeth. We just saw this before. There will be brownish discoloration and the formation of ill-formed teeth. Let us look at E and V now on the next page. E stands for expired tetracyclines. This is also a very, very important side effect. Normally we always see the expiry date of a medicine before taking it, but in the case of tetracycline it is even more important because expired tetracyclines are known to cause a very deadly syndrome, that is Fanconi's syndrome. Now Fanconi's syndrome refers to a disease in which there is decreased reabsorption from the PCT, and it is caused by consuming expired tetracyclines. V will stand for vestibular toxicity. Minocycline especially causes ataxia, vertigo, and nystagmus. Let us look at a few contraindications now. I just told you that tetracyclines are contraindicated in pregnancy, and they are also not to be given intramuscularly because it is a very painful route. They also cause super infection. I mean, this is not a contraindication, but just an additional point that tetracyclines will cause super infection. Super infection is a disease that can be caused by broad spectrum antibiotics. Because when we give a broad spectrum antibiotics, what we are doing is that we are suppressing the normal flora as well, and normal flora protects our body from diseases. So if we suppress the normal flora of our body for a prolonged period, it can also give rise to the growth of pathogenic bacteria that can cause further infections. So this is why tetracyclines can also cause super infections. Finally, let's look at a few uses. This can be learnt by the acronym Sri Lanka, again taken from the GRG textbook. S here stands for SIADH, the syndrome of inappropriate ADH secretion. We just saw earlier that dimeclocycline was the cause of antagonizing ADH secretion, and that led to a condition like diabetes insipidus. But this property of dimeclocycline is actually helpful in a situation like syndrome of inappropriate ADH secretion, as there is increased ADH production in this condition. So if we give dimeclocycline to the patient, dimeclocycline will antagonize the production of ADH, and thus this condition can be sorted. R here stands for rickettsial infections. Tetracyclines are even the drugs of choice in this case. Rickettsial infections like Q fever and typhus. I stands for I, granuloma inguinale. For this disease, azithromycin, which is a macrolide, is preferred, but doxycycline is also given. L stands for lymphogranuloma venereum, or LGV. Here again, azithromycin is preferred as the first line drug, that is the drug which is given, which is the first option of the clinician to give to the patient. Doxycycline can also be given, though A and N collectively stand for atypical pneumonia. For this condition also, azithromycin is preferred, but tetracyclines can be given. K stands for cholera. Tetracyclines are the drug of choice for cholera. And A stands for amoebiasis in GIT infections like chronic intestinal amoebiasis. You must remember that in the susceptibility portion, we learned that high concentrations of tetracycline can also counteract against Antiamoeba histolytica. So they can also fight against amoebiasis. Thank you, and I hope you gained something out of this video.